So last we spoke of, we started with Ophidia, if I am right. Okay. So we finished Crotalus in the last class. Okay. So I'll start with a new snake remedy. Okay. And we'll see, must be 45 minutes. We'll see what best can be done to this particular snake remedy that we will be dealing. So quickly, what was important in Crotalus? What were the key symptoms of Crotalus? Okay, it's hemorrhagic, yes? Huh? Okay, it causes degeneration of the blood. See, the previous class will have a kind of a relationship to the present class, because we are talking of Ophidia. Now, your ultimate goal or aim should be how to differentiate the Ophidias among one another. Okay. So now I will be introducing a new Ophidia. So unless you know the previous Ophidia, this will not sink in. Okay. So the Ophidia that we are going to discuss today is from the image. Now, what made you think of ELAPS? Must be you would have seen this somewhere before. Okay. Now, ELAPS is what we are going to discuss in detail. I'll try to give you a brief information about this snake, and then we will try to understand. Okay. So before I start giving information from my side, you have anything to talk about this creature, ELAPS? Huh? Okay, it's got neurotoxin, agreed?
Right-sided.
Okay, right-sided. I don't want the symptoms of ELAPS. I want you to tell me about the... Okay, it is colorful, fine. Huh? Okay. Coral color, very good. Coral color, okay. And this is a creature that you mainly see in the coastline, okay. Right. So if it, coral is what Dr. Shilpa rightly said. So this is what you see in the coastal line, okay. So I'll just read this. Coral snake or painted coral snake is the common name of ELAPS. And as you see the statement here, it is a highly venomous elapoid snake which is native of South America. And like many snake venom or many snake remedies that is prepared, even ELAPS is prepared from pressing the venom snake of the living snake, and this venom is triturated with sugar of milk. This is how you know many of the Ophidias are prepared. In the similar fashion, you also have ELAPS being prepared. Okay. Now, this is what I was trying to highlight. It is a snake which is found on the coastline, and like many Ophidias, it is also a nocturnal creature. It is also a nocturnal creature, and a beautiful statement goes, or a beautiful statement follows. It is a shy snake, always found underground, comes out only in the rain. Okay. Probably it can be one very important doctrine of signature. Okay, must be, not exactly doctrine of signature, or what we try to understand from the behavior of the snake. When we understand the mind, we'll use this symptom and we'll try to interpret. Okay, so this is the basic information. It's a snake found on the coastline, and it is native of South America, highly poisonous snake, and it, like many snakes, it has both hemo and neurotoxin. Very important. Both hemo and neurotoxin. Okay. This is what you have here. Now, what is there in the venom? What happens if the snake bites? Okay. So it has got a neurotoxin which causes neuromuscular block, which results in death from respiratory arrest, which is a result of the paralysis of the respiratory muscles. This I told you in the first class when I did the pathogenesis. How or what happens when a snake bites. Okay, fine. So predominantly a neurotoxin, but ELAPS primary action is on blood. Okay. So what I also want to try to tell you is there is also a hemotoxin which is there in ELAPS, and this hemotoxin mainly acts on the blood cells. Okay. And Shalaka was using the word, it acts on the blood cells and it causes degeneration, disorganization, degeneration of the blood cells. And the direct result of which will be anemia. Okay. So this is what you see here. Disorganization of the blood cells, and then you see hemorrhages, and then the hemorrhages, and of course, you will also have ELAPS getting indicated for septic conditions. Septic conditions. You have boils, you have carbuncle, okay, and you have boils, you have carbuncles, you have ELAPS mentioned under gangrene. ELAPS mentioned under gangrene. So septic condition, septicemia, this is what you also have in ELAPS. Okay. Better remedies for septicemia? Very good. Pyrogenum, anthraxinum, agreed. Pyrogenum, anthraxinum, Crotalus. Many Ophidias, that's what I was trying to tell you. Many Ophidias, are mentioned under the rubric septicemia. And Crotalus tops the list. Under the rubric septicemia, you have septicemia with nausea. There's a small rubric in your repertory, generalities, where surprisingly you see, must be this here, you see almost all Ophidias mentioned there. There are only 7 remedies mentioned under this particular rubric. Septicemia accompanied with nausea. You have ELAPS, lachesis, vipera, Crotalus, horridus. Okay. The better remedies for septicemia, you have arsenic, Crotalus, carbovage, echinacea, lachesis, and pyrogenum. Okay. So septicemia is what is a result of the action of ELAPS on the blood vessels or the blood cells. Second very important area, we spoke of this being a neurotoxin. So acting on the nerves. What is ELAPS capable of causing is very important. Okay. So it can cause 2 very important things. One is paresis, and second thing is it can actually cause paralysis. Okay. So paresis and paralysis is what you need to remember. So we are trying to understand the spear affection and pathogenesis of ELAPS. Done? Okay. Any questions? Any clarification you need here? I hope it is clear. In the previous slide we spoke of the creature itself. We try to understand from the color. It looks like that coral color, right? And that's how it's also got that name. And then it's a highly venomous snake, and generally comes out or generally active in rainy season. Okay. So going ahead, what we also see is not only blood, nerves, you also see ELAPS having an action on the ears. Okay. Now acting on ear, what will ELAPS do? It will mainly cause otorrhea. So that's CSOM. Okay. So you can see otorrhea. and the otorrhea in ELAPS will be offensive. ELAPS otorrhea will be offensive. Okay. You might be knowing many more remedies having offensive otorrhea. Like we have Merxol. Huh? Okay, Merck, Hepar, Tellurium. That's the remedy I wanted. A rare remedy which also has otorrhea. And the character of smell in Tellurium will be fish brain. You know, when you wash fish, that water, you know, the kind of smell it has. That is the kind of otorrhea, or that is the smell of otorrhea in Tellurium patient. Rare remedy, but you should know, okay? So not only otorrhea, not only ear, you also have ELAPS acting on the nose. Acting on nose, it mainly causes inflammation, ulceration, okay? And then there can again be offensive discharge coming from the nose, okay? Rhinorrhea, which can be offensive, okay? So inflammation, ulceration and offensive nasal discharge is what you have in ELAPS, okay? Another sensitive area, like many Ophidias, you also have ELAPS acting on the throat, okay? See, more than the sensitivity of the external throat, what you see here is ELAPS will mainly cause inflammation, internal inflammation. The muscles of the the muscles of the pharynx and the esophagus, they go into spasm. They go into paralysis. Okay? So you will see them having difficulty in swallowing or food coming out through the nose, through the nostrils is possible in ELAPS. Okay? So inflammation, muscles of pharynx and esophagus going into a spasm. Okay? Now very important is the causative factors in ELAPS. There are two causative factors mentioned in your books. One is, I'm not very sure if the image is clear, but one thing what you have is insect bite. Insect bite. Okay? Insect bite. Done? So insect bite, you have, what are the other remedies you can think of? Ledum, yes. Ledum is a remedy for mosquito bite. You got a lot of bites in ledum that it covers. Good. Ledum, acetic acid, caladium, yes, caladium, apis, bee stings, stings of poisonous insects. Poisonous insects, one more remedy should come to your mind. Okay, anthraxinum, echinacea, I mean, I've been repeatedly telling. Echinacea is a beautiful remedy for injuries of poisonous stings like scorpion. Okay, poisonous stings. Tarantula can be remedy for spider bites. Okay. Anthraxinum, apis, cedron, crotalus, ledum, Urtica urens. Urticaria after stings. Urticaria after insect bite. You can think of Urtica urens. Okay. Going ahead, what you also has a very good remedy for snake bites. Snake bite as a causative factor. Better remedies? Better remedies for snake bite. Okay. Okay, many Ophidias, and not only Ophidias, you also have arsenic, apis, belladonna, cenchrys is an Ophidia, bipara, lachesis, that again Ophidias. You can also add echinacea and ledum to the list. Echinacea and ledum to the list. Okay. So two ailments you have in ELAPS: insect bite, snake bite. Okay. Now, before I take up the other very important component, a quick recall of what we did. ELAPS is what I started. we introduced you to the snake and we spoke two small areas. One is sphere of action. Like many Ophidias, it has an affinity for blood. It will cause disorganization of the blood leading to anemia or septicemia. Two things. And then we saw acting on the nerves, it will cause paresis and paralysis. And then we saw acting on its action on the ears, nose and throat. Okay. Now we spoke of ailments. In the next component, we look at something very important. What is this? What is this? Okay, look at this. Is this normal, abnormal? What is this? Why you feel it is different? Why you feel it is abnormal? Because it's got something which generally a chick will not have. So what is it that I am aiming at? We are looking at pictures. We are looking at pictures. Okay. I got a different picture today. Okay. So this will be a common symptom. And in today's class, we are not focusing on this. We are focusing on what is uncommon, what is different, what is unusual, what is rare, what is peculiar in ELAPS. Okay. So peculiar symptoms of ELAPS and bang. We have a very characteristic symptom coming up. Now what do you see there? Hope the image is clear. Hemorrhages. In the video it's coming clear? Okay. So when or should we make the room more dark? In the cover, curtain haakbirತೀರಾ in there? Okay. Well, yeah, anyway, meanwhile, we'll focus on this area. What are we looking at is, we are trying to understand the discharges. In ELAPS, the discharges are black. Very, very important. Okay? Fine? The only remedy mentioned under discharges black under the chapter generalities is ELAPS. Is that going to make any difference, Dr. Shweta? Okay, thanks. So, the discharges are black, important. So, we'll also try to understand what are those discharges which are black in ELAPS, okay, and which are all the other remedies which are having black discharges, okay. So, any inputs from your side, what could be black, or what are those discharges which are black in ELAPS? First question. And for comparison, which are all the other remedies which will have black discharges? Okay, like I said. Okay, then. Okay, anthracynum. Anthracynum is there. Agreed. Okay, so we will quickly look at ELAPS, the discharges of ELAPS, and the discharge from the ears. Brahma, if you don't mind, the discharges from the ears. Okay. Fine. Chalo. So the discharges from the ears, we already saw the sphere of action. Otoria can be black. Okay. Not only otoria, any wild guess what else can be black in ELAPS? Wax. No, ear. Limiting to ear. Wax. Black wax. Wax can be black, otoria can be black. Okay. Now, the discharges from the nose can also be blackish. Now, Dr. Shweta was talking of discharges from the uterus. The menstrual flow can be black. It's a beautiful remedy acting on lungs. Especially having an affinity for the right lung. Okay. So, ELAPS can cause black sputum or hemoptysis. We'll talk of blood under a separate heading. But for time being, we are looking at black discharges, and we are also trying to explore the possibilities of black discharges in ELAPS. Okay? So ear, nose, uterus, lungs, and even the stool in ELAPS can be black. Black. And I don't know, I vaguely remember reading somewhere, the snake stools are black in color. This statement needs to be verified. I remember reading it long back. Okay, I remember reading this under the remedy lacasis. I don't remember the author's name. One author, as a doctrine of signature, the author compares that stools in Ophidias are black because snake stools are also black. But as I just tried to tell you, please verify this statement. Okay? We'll get back. So these are all the areas from where you can have black discharges. Discharges are black, one component, and second thing, you also see that the discharges are offensive. Discharges that mainly comes from the ear and the nose, the otoria and rhinoria can be offensive. Okay? So ear and nose. Right? What is this? Black tongue. Black tongue. Any other remedies you can recall? Black tongue. Many Ophidias, they have black tongue. Other than the Ophidias. You should also think of carbovage. You can also think of China. Okay? And phosphorus, murk. Top 4 remedies having black tongue. Black tongue means the discoloration will be black. Okay? See, not only the tongue, even the tonsils can be black or it can be purplish. Black or purplish. Okay? One more remedy in which you can have black throat in general can be murk sulf. Not murk sol. Murk sulf is another remedy which can have black throat. Okay? Now, we looked at ELAPS having the tendency for black discharges, offensive discharges, and from where do we see discharges is also we try to understand. Now the second thing is, for a PG student, you should also know which are the other remedies which are there or which are capable of producing black discharges. Okay? Now, any wild guess which are the remedies? Anthraxinum is there, agreed. Say for example, if you have black discharge coming from nose, when you have black clots coming from nose, you have a single remedy mentioned, and that is sanicula. Single remedy, and that is sanicula. Okay? If you have bloody otoria, okay? See, in ELAPS we saw black cerumen, meaning wax, which was black. But when you have black discharge coming from the ear, the only remedy mentioned in your books, it's again a Ophidia, and that is naja. That is naja. Okay? Black discharges, naja. Okay? Now what is this? It's an ulcer. So when you have discharges which are black and they're coming out from the ulcer, you have a series of remedies. You have a set of remedies. Okay? Any remedies that you can recall? Okay? More than anthraxinum. More than anthraxinum. See, you have Sikane, China, Hemamelis, Lyco, sulfur, and of course anthraxinum. Blackish discharges coming from the ulcers. Okay? So this is also another nice symptom you have in ELAPS. Not ELAPS, sorry, you have in some homeopathic remedies. See, when you have what is this? Very good. So, when you have discharge from the abscess, and if the discharge is black, okay, fine. You have a few remedies and blackish discharges from the abscess. Again, bryonia, china, lyco and sulfur. See, from the ulcers, if you have black blood coming, the only remedy we have is carbovage. Okay? From the ulcers, carbovage. Hope this is clear, this slide is clear. We spoke of otorrhea from the nose, from the abscess, from the ulcer, okay? Any black discharge. See, once we are done with the discharges, I have taken this from complete repertory. Hemorrhage's tendency, and the hemorrhage is black, or when the bleeding is black, homeopathy has 36 remedies to offer. Okay. Now if you see the list, you have from ammonium carb till vipera, you have so many remedies. Crotalus horridus is there, and lachesis is there, and of course vipera. 4 Ophidias are mentioned here. Bothrops, 5. So what I want you to understand is, among 36 remedies which are capable of producing black hemorrhages, ELAPS is also one of those remedies. So hemorrhages which are dark, which are black, which are non-coagulable. Okay? This again I have taken from complete repertory, and what it says is menses intermittent blood black. Please understand the statement properly. What is this? Menses intermittent. Okay? And when in the intermittent flow will have black blood, or it is black in color. The only remedy, single remedy is ELAPS. I am trying to highlight the importance of ELAPS. Similarly, there are a few more single remedy rubrics. Pain in chest, pain tearing in the region of heart, spitting of black blood with acid proceeding from heart. See, pain, chest tearing, acid proceeding from heart, and there will be spitting of black blood. Again, the only remedy is ELAPS. Similarly, cough dry, and cough ends in spitting blood, and that blood is again black. It is dry cough. He coughs, and what is the end product? Is coming up with black blood. Again, single remedy, and that is ELAPS. See, this is what I was trying to tell you under the intestines, the rectum, the anus. What is it? Stools frothy, bloody, and it is black in color. Again, single remedy is ELAPS. Single remedy is ELAPS. Okay. The third thing, the first thing we saw was discharges, and the second thing we just spoke was hemorrhages, and third thing we are looking at is the side affinity. ELAPS can affect both the sides. Okay. I also just tried to shortlist few things. It has got an affinity for right-sided paralysis. Hemiplegia, one-sided paralysis, right. Okay. But left-sided headache and left throat affection. Left-sided headaches and left-sided throat affections can be ELAPS. Okay. Right-sided paralysis. Done? So we'll go ahead and we'll look at this, the last part of ELAPS for today, and we'll continue the remaining part in the next class. Now the fourth point I am trying to highlight here is paralysis. We saw that it's a neurotoxin. It can cause paralysis. Okay. Now, what is that paralysis you have in ELAPS, first point? And as an extension of this symptom, we will also look at the other Ophidias which are capable of causing paralysis. Okay. So paralysis, any idea? We saw from the sphere of action, we saw from the side affinity. ELAPS mainly causes paralysis of one side and mainly right side. Okay. So that's one part of ELAPS. And your repertory gives a beautiful symptom of ELAPS. Spasms followed by paralysis. Only 5 remedies are mentioned under this thing, that there will be spasm first, then there will be paralysis. And ELAPS is one remedy mentioned among those 5 remedies. Okay? Now, which are all the Ophidias which are capable of causing paralysis? This is a question for you. Which are all the Ophidias which are capable of causing paralysis? Bothrops, agreed. Crotalus, lachesis, good. What happens in bothrops? Yes, bulbar palsy, good. Okay, so we look at a few snakes, few Ophidias. To start with, this is Crotalus. Okay, now Crotalus horridus, after apoplexy, after a cerebral hemorrhage. Okay, if there is paralysis, and as you know, the paralysis in Crotalus is mainly right side. Okay. Now another Ophidia which is also capable of causing paralysis is Crotalus cascavella. A very lesser known Ophidia, but a beautiful remedy we use in our clinics, and must be when time permits we can also explore Crotalus cascavella. Okay, sorry, this is Synchris. Okay, sorry, this is Synchris. Crotalus cascavella will come a little later. See, Synchris has paralysis with aphasia. When they have speech difficulties, when the speech center, what is that? Broca's area, correct, no? Huh? So when that gets affected, okay, the remedy is Synchris. The remedy is Synchris. Okay. Only 3 remedies are mentioned. Paralysis with aphasia, and Synchris is one among those 3 remedies. So I'm just trying to tell you it's an important remedy. Okay. And this is Vipera. Vipera also, like many of the Ophidias that you see here, after apoplexy, after cerebral hemorrhages. This was the snake I was talking, and this is Crotalus cascavella. Crotalus cascavella. Again, a right-sided remedy. And here again you have paralysis after apoplexy. Okay. Bothrops, Dr. Netra has already told us. We will look at another area, other Ophidia, and this is Naja, our own Ophidia, Naja. So Naja mainly causes paralysis of the sphincter of the organs. only remedy mentioned in your books. Paralysis of the sphincter of the organ. Like for example, bladder, rectum, that sphincter will go into paralysis. Naja. And the last remedy is surukuku, okay, which is lachesis. In lachesis, what information can you share about lachesis? That it is left-sided, hemiplegia, one-sided, left-sided, and after suppressed eruptions. Paralysis after suppressed eruptions. Paralysis after suppressed perspiration. Okay? And paralysis from abuse of alcohol. Paralysis from abuse of alcohol. And they will have a staggering gait. So this is the information. Stumbling gait, left-sided after apoplexy. Awkward stumbling gait. And I gave you the cause. What can happen in lachesis. Okay? We have 2 or 3 more characteristic symptoms that I will club with the mental symptoms of ELAPS in the next class. Okay. So today's class, is it clear? We have covered a very small area. Small area comprising of the sphere of action, the ailments, 4 characteristic symptoms with comparison. Okay? Any questions? All clear? Okay. If it is clear, fine. Thank you.